Sylvia in the studio. And this morning we're going to have a conversation on contact lenses. So she is Dr. Sylvia Boamah. She's with Lotus Opticals. They are in East Legon and they are in Sakumono. And they have been taking care of me, for a while now. I'm enjoying the baby girl treatment that I'm getting from Lotus Opticals. Good morning, Dr. Sylvia.
Hi, Natalia.
How are you?
I'm doing great.
You're looking great.
Thank you.
So, the conversation on contact lenses.
Right.
Let's get right into it. I've seen, especially on social media, a lot of people put on contact lenses. Cosmetic, and then, the ones prescription. I really can't tell what the difference is, but I see that it is quite the alternative for people who do not want to put on glasses all the time. Right. Or sometimes for a special occasion, you may want to, for instance, I reckon for anyone who wears glasses, maybe on your wedding day, you don't want to wear glasses, right? But you may want to see just fine.
Yes.
So then there could be the option of wearing contact lenses just for that day. I think my interest, where I'm hoping we can pick the conversation from, is a long time ago, I wore some contact lenses and I went to bed. And I woke up and I had only one on and the other one I couldn't find it. So I thought it had come out of my eye during sleep, and I tried to find it, in the bed sheets and everything. I couldn't find it, but I thought, okay, whatever, maybe it's missing. So I took this other one out and I went about my day doing whatever. Then later in the evening, it came back on my eye. And I thought, where did you come from? So then it was a very scary situation for me because I felt like, so it must have gone all the way back. Like, where was it? And it came, back out. And it was after that experience that I was told that you never sleep with your contact lenses. But the person that sold it for me at the time, because it was cosmetic, at the time didn't mention that to me, as it was very foreign to me. So I'm hoping that before we get into the details, first of all, let's talk about the do's and don'ts for anyone who wears contact lenses, whether cosmetic or prescription. Then we can get into the main conversation.
Okay. I'm smiling because I like the fact that you're giving me your personal
Yes,
experience.
very personal experience.
With contact lenses.
Yes.
So yes, contact lenses, the gold rule or the gold standard with contact lenses is that you do not sleep in your contact lenses. Although there's an exception to that, there are some specialized types of contact lenses that you can sleep in.
Okay.
For certain reasons, could be therapeutic. Maybe the person probably has an injury to the eye. Okay. So we put in the medication and give you that specialized type of contact lenses.
Okay.
So that, it's supposed to help with the healing process.
Okay.
However, contact lenses, generally, you do not sleep in them.
Right.
They are made from, we call it hydrophilic material. What that means is that, it allows water to circulate. Okay. And it also allows oxygen to circulate. So contact lenses are generally very safe for use. However, you need to get it from a proper, or let me say, a licensed professional. In this case, you need to get contact lenses from the eye clinic because it's a medical device.
Right.
A lot of the time, I discourage people from getting contact lenses from makeup artists, buying off the shelf from pharmacies. Oh, I know somebody who sells contact lenses. A lot of the time, I discourage that because a lot of training goes into contact lenses. Okay. Before I will dispense contact lenses to you, I take you through a series of training, consultation. Okay. People take that for granted because I can just fix it on my eye, so let me just buy it off the shelf. No. You're only allowed to buy it off the shelf if you've gone through consultation with an optometrist. Okay. You know the do's and the don'ts. Okay. Now, a lot of people don't know that contact lenses, you can easily contract an infection with contact lenses. Yeah. Why is it so? The lenses are sitting directly on your eye. So if there's any A tiny bit of bacteria on the surface or on the back of the contact lens is sitting on your eye for a minimum of 6 hours, 7 hours, 8 hours. Bacteria also thrives very much in moisture.
Yeah.
Your eye surface has tears on it. So what are you doing? You're feeding the bacteria on the lens to grow.
Right.
So when you get it from a professional, you're taught how to handle the lenses, what to do, what not to do. Typically, you should never handle your lenses with dirty fingers. You say, oh, my fingers are not dirty. But if you put your fingers under the microscope now, you'll be surprised what you see on your fingers.
Right.
Which is why people who wear very long nails, we would recommend that you use an applicator.
Right.
To handle your lenses.
And not your nails.
And not your nails. Using your nails, chances are that you even rip the lenses.
Right. They are very delicate.
Very delicate. They are made of extremely soft material so that when it's sitting on the eye, you don't feel it.
Right.
So the contact lenses are made from different types of material, breathable material. Emphasis on breathable because the surface of the eye, which is the cornea, needs to breathe.
Right.
And so you need a material that will allow water and oxygen to circulate.
Right.
Now, when you forget yourself and you fall asleep in your contact lenses, what you're doing is that now you're depriving your cornea, the surface of your eye, of oxygen and fluid.
Right.
Your eyes are closed. You're sleeping for a minimum of 7 hours. Even your nostrils, if you block your nostrils for just a few seconds, how do you feel?
Yeah.
And then your eyes are closed. You have contact lenses on your eye. What's happening to your cornea?
Right.
You were lucky. Typically, people will wake up with red, inflamed, painful eyes when they sleep in their contact lenses.
Wow.
When this goes untreated, it can lead to, corneal melt. The surface of your eye can melt away, and what you probably would need will be a corneal transplant, which we don't do in Ghana.
In Ghana.
Right.
Wow.
Yes. So you need, just as when your car develops an issue, you don't take it to a carpenter.
Yeah.
Why do you want to get contact lenses from somebody who's not a professional?
Yeah.
Yes, price. People will talk about price, but your eye is not something you want to gamble with.
Yeah.
If one eye goes off, you're left with just one. And to do things like driving, reading, walking, you need binocular vision. You need both of your eyes to work in sync. Because the right eye picks signals from your left periphery.
Right.
Your left eye picks signals from the left periphery, and they work together to make you see. Right. So, Natalia, as you're looking straight at me, you can still see what's on your left.
Yeah.
And you can still see what's on your right.
Yes.
So that means that you have very good binocular vision.
Right.
Now, not to say that contact lenses are not good. I said earlier they are generally very safe for use if you know what you're doing.
If you follow the rules and regulations.
Thank you. If you know exactly what you're doing and if you know how to handle them, you will not have any problem whatsoever.
Right.
So I know somebody who sells contact lenses. It doesn't wash. In other developed countries, you cannot just go and buy contact lenses from anybody.
Right.
It has to be from the eye clinic. You need to see your optometrist, have your assessment done, and the contact lenses are dispensed according to your requirements.
Right.
For anybody listening to me, if you pick your contact lens box, you find that on one side of the box, it has certain dimensions stated on there. You will have the base curve, you have the diameter, you have the water content percentage. All those things are not there for fun.
Right.
They are things we look out for whilst we're dispensing contact lenses to you.
Okay.
So they are medical devices that should not be taken for granted. At all. Now, they serve the purpose of helping people to see clearly, especially for people who don't want to use spectacles. They don't want to have anything hanging around their face. Their prescriptions are so high. If you give them spectacle lenses, the lenses are so thick, and they don't want, just so that they can have an aesthetic appeal, they opt for contact lenses. However, due to technology, people can now be fashionable about
Yeah.
their contact lenses.
Right.
So it's helping them to see, but they can also have it in colors.
Right.
So you find somebody, oh, your eyes look blue. Oh, your eyes look green.
Yeah.
The person has contact lenses on. So it's helping the person to see whilst also giving them the cosmetic appeal.
Right.
So which is why now you find that a lot of people are switching to contact lenses. But the advice is that you use it interchangeably with your glasses.
Right. So that it's not just that.
Exactly.
Okay.
Just so that you allow your eyes to also breathe.
Right.
We do have types of contact lenses. We have the monthly disposable, we have daily disposable, we have bi-weekly. So it really depends on your schedule, how you think you can handle the lens. The lenses come with a lot of responsibility.
I
It's
can
like having
tell.
a child.
I can tell.
Yes.
I can tell. So when you say monthly disposable, what does that mean? It means that you can use it for a whole month before you dispose it off.
That's correct.
Okay. Interesting. And so within this month, you're going to have to take very good care of it.
So
Because-
every night, irrespective of what type of contact lens type it is, whether it's monthly disposable, whether it's daily disposable, bi-weekly, every night you need to take your lenses out of your eye
Right.
before you go to bed.
Okay.
Okay. So yes, even though it's a monthly disposable, you dispose it after 1 month of use. It doesn't mean that you wear it continuously
For a month. Yeah.
Every night you take it out, store it in your lens solution in your lens case, and then you use it the next day
Right.
if you require it. For daily disposables, you don't need to store it. It's not very necessary. The lenses,
After the day is done.
yes, the lenses are made such that you are supposed to dispose at the end of the day.
Right.
The monthly after 1 month. So typically the monthly lenses has more than a pair of lenses in there,
Okay.
so that just in case one breaks along the line, you have a spare
To do it.
to replace.
So,
Yeah.
Doc, tell me something. What happens for a daily disposable? What happens if you decide to use it the next day?
Typically, because they are not made to be used for more than one time, a lot of the time the lens will break after
Okay.
the first use.
Okay.
When you take it out and you want to try to put it in, a lot of the time the lenses will break. However, some people are able to, manage their way, and they're able to use the daily disposable lenses more than once.
Right.
But for,
And does it
sanitary-
work properly?
Yes, it works. It will work properly.
Okay.
The only thing is that they are at risk of developing dry eyes
Right.
because the lenses are made for one-time use,
Right.
and then you're forcing it to work more than once. So it loses its water content. The oxygen permeability is also not as robust as the first time use.
Right.
Yeah.
Now let's talk about cosmetic contact lenses, which for a lot of people, which was my predicament. I mean, I know a lot of people just like you rightly said, the aesthetic. Oh, I have blue eyes and green and yellow and all of that.
Yeah.
So people like to do it from time to time. Those ones equally comes with a lot of rules and regulations. However, because of the places where, for instance, where I got it, it didn't come with anything. It's just the person I sell it, I bought it, I took it away. I had to find out for myself, even the application and everything, I found out for myself. So for cosmetic contact lenses, for anyone who uses them, how are you able to tell, okay, how long should this go for? Okay, and I know that it comes with a solution. Are you changing the solution every day after use? How does it work?
Contact lens solution should be changed daily.
Okay.
The case needs to be cleaned daily. So, which is why I said it comes with a lot of responsibility. It needs constant cleaning so that you don't pick up bacteria, you don't pick up an infection.
Right.
So, yeah, you need to change the solution daily. You need to clean the lens case daily. I know I'm pretty sure some of my clients are listening to me.
Yeah.
Somebody will keep her case for like a whole month without washing it.
Right.
She just, throws out the
old one and replace
and then
it.
replace with fresh.
Right.
Yeah. But I mean, the whole idea is to try not to pick up infections because at the end of the day, your eyes are going to suffer. You are going to suffer.
Right.
Yeah.
And the cosmetic ones, how are you able to tell that, okay, if I got cosmetic contact lenses, this is how long it can go. Because maybe, I don't know, maybe somebody will get it and want to wear it the entire year if it doesn't tear or something. Like,
Right.
how will one know?
Right. So a lot of the time, there's information on the packaging. So if I pick a contact lens package, if I see the lens material, I know how long you can use it for.
Right,
I have training in that, so I
Right.
can just tell.
right.
If you go to just anybody in quotes who sells contact lenses, the person doesn't even know what that means. So when you come to me in the clinic and I'm taking you through consultation, I can tell you, Natalia, this material, you can go as far as 30 days.
Okay.
With this material, you can go as far as 90 days. With this material, you can go as far as 6 months before you replace your lenses.
Right.
So it comes down to getting your lenses from a licensed professional.
Right.
Yes.
Who will be able to tell you.
Yes.
I also know of a situation where, somebody may get cosmetic contact lenses. I don't know, maybe they got it in, okay, so for instance, my birthday was in February. So maybe I decided that I'm getting contact lenses for my birthday. This was in February. Right? And then after that it's in the water, in the container, whatever, breathing. And then I can decide next month in August that, I have an event. And I decide to go and get it and put it back on, which is something I want to believe that there will be people who operate
There
that way.
are people who are doing that.
Exactly, because I feel like, I used it only once in February this year. I don't see why I can't use it again in August, It's like only one time I wore it. You know what I mean? Because
So
I'm sure there will be people who feel that way.
There are people who are into this kind of practice.
Right.
So now, the interesting thing about contact lenses in solution in the case, for some reason, when you leave it unattended for even a maximum of 2 weeks, you come back to it and you find that all the solution has evaporated.
Oh, right.
And the lenses are dry. You just touch it and they fall apart. It breaks.
Right.
It just falls like a dry onion peel. When you just touch
it breaks.
Yes. So no matter how much you try to cheat the system, the
It's
lenses
not quite.
it won't work.
It won't work.
However, if maybe you're changing your solution as often as possible, you try to change the solution as often as possible. A lot of the time, I will not recommend, because the lenses have been sitting in that lens case for February to August. That's a long time.
Yeah.
You can't imagine how much bacteria you've brewed
Yeah.
in that thing, because you're not washing the case daily.
No, you're not.
You're not changing the solution daily. And the lens is just sitting there. And so the bacteria is just growing on the surface of the lens, both the front and the back.
Right.
So you imagine picking it up, putting it on your eye. Just imagine what you're causing to your eye. So when you leave your lenses for a long time would be like a month. The best thing would be to pop a fresh pair.
Just replace them.
Just replace with a
Wow.
fresh pair.
So then it's a very I'm trying to find a word. It's the word is not coming. So, I mean, the whole situation of using contact lenses, it needs a lot of care and
Yes.
attention.
Yes.
Which is something that not a lot of people have.
Yes. However, once you get used to, from the beginning, it looks so cumbersome and all of that, because you're not getting a hang of it. But once you get used to your contact lenses and you know what to do, within a matter of like 3 minutes, your lenses are in, you've cleaned your solution.
And then you're good to
gone.
go.
Yeah.
Right. Also, early on, you said that a maximum of 6 hours, you're supposed to have your lenses on. So for instance, if I'm using lenses and I don't know, maybe I leave home at 7 a.m., right? And I have usually a long day and I'm getting back home at 7 p.m. That's more than 6 hours.
Yes.
So what happens in this case?
So, typically we'll give you what we call re-wetting drops.
Okay.
So let me correct that. You wear your lenses for a minimum of 6 hours, maximum 8. It's 6 to 8 hours.
Okay.
But some lens materials will allow you to go as long as 12 hours.
Okay.
So that's like if you leave home at 6 in your contact lenses, 6 p.m.,
66.
Yes.
Okay.
However, if you go beyond the
That.
threshold of the lens material, you find that your eyes begin to feel dry,
Right.
irritated, slightly reddish. Usually that is not so much of a problem. Once you put in your re-wetting drops,
Okay.
it
Do
refreshes.
you need to take them out to re-wet them?
For the re-wetting drops, no, you don't
Okay.
need to take out your lenses.
Okay.
You can still have your lenses on your eye, and then your drops go in.
Okay.
It's sort of to refresh
Okay.
the eyes and replace the water content, make the eyes feel refreshed. But if you don't have your re-wetting drops on hand, the advice will be to take them out and then probably switch to your glasses if you have it
Okay.
on hand. And I mean, typically, it's difficult I'm not sure you can be out for a whole 24 hours.
No. 24
like
hours,
12
no.
midnights to 12 midnights.
No. 24
You
hours, no.
definitely,
Yeah.
so people will typically do 8 to 12 hours maximum. So
Which
depending
can
on-
be accommodated.
Yes, which can be accommodated.
Okay.
But where you begin to feel some, irritation or an uncomfortable sensation, you just use your re-wetting drops and you should be fine.
Okay. Dr. Sylvia, tell me something. How do I even... Is every eye, or is everybody's eye good for contact lenses? Are there some particular people who, I don't know, maybe for this and that reason, may not be able to use contact lenses?
Yes.
Okay.
Contact lenses isn't for everybody.
Right.
The first people who would qualify to use contact lenses are people with very high prescriptions. So let's say, starting from like -4, -6, +5, where your prescriptions are very high and your glasses lenses are so thick, you are a candidate, you qualify.
Okay.
People who do not qualify to use contact lenses, especially people who work in the construction industry,
Right.
who are on the field. You can imagine how much dust settles on the lens. So if you're a construction worker, when you come into the consultation, we ask you, what is your job description like?
Okay.
Some people will take offense. They feel like maybe you want to know what they do to, sort of weigh them, but that is not it.
Right.
A lot of the times when you go to see the doctor, you need to be as transparent as possible. We ask you basic questions to guide our work.
Right.
So if you're a construction worker, no, you can't use contact lenses.
Okay.
If you are a swimmer,
Okay.
it's dicey.
Right.
If you, work with chemicals,
Okay.
we don't also recommend it.
Okay.
So typically for people who spend most of their time indoors, because the whole idea is we're trying to cut out as much bacteria as possible.
As possible.
So anything that
Okay.
exposes you to bacteria, it's not recommended. There are also people who tend to have scars on their cornea. We call them corneal scars.
Okay.
They develop these scars as a result of probably surgery, an injury. It could be anything. After the wound got healed, it left a scar. So you can be looking at somebody and you find that the black part of the eye has a white patch.
Around it.
Around it, on the side, it could be anywhere.
Yeah.
So for those people, we also have specialized contact lenses. We call
Okay.
them masking lenses to cover up the scar, to make it
Right.
look just like the other one that is in.
I think I actually saw a video you posted
Right.
about black
Yes.
contact lenses.
Yes.
Yeah. So
Yes.
then nobody would know that you have anything on.
Exactly.
Very interesting.
Yeah.
Very interesting. What about the sun? What is the relationship between contact lenses and the sun?
So if you're somebody who is photophobic, you don't like the sun much. When you step out into sunlight, you need to be squeezing your eye.
Yeah.
And contact lenses may not be ideal
Okay.
unless you're using it together with sunglasses.
Right.
Okay, so you have your contact lenses on, you just slap on your sunglasses to give you a cheek feel.
Yeah.
However, recent technology for contact lenses now incorporates UV blocking technology in some
Okay.
brands.
Okay.
Not all brands
Not
have
all.
it.
Some.
Some brands have
Okay.
UV technology incorporated. So you find it written on the box.
Okay.
UV technology. in there. So with those ones that have UV technology incorporated, it blocks out, UV light from sunlight to an extent. Our focus is on UV light because that is what eventually will cause you to develop cataract in future.
Right.
We'll talk about cataracts later on. What's, locally they call ete.
Right.
Ete on the eye.
Okay.
UV is what's responsible for that in the long term. So which is why we recommend that if you're getting sunglasses, it should be polarized lenses because that's what filters the UV.
Right.
If it's contact lenses, you go for, if you can't afford it, you go for one that has the UV technology, UV blocking technology.
Okay.
If it's prescription glasses, we advise you go for UV blocking, or if you can afford the UV blocking, you go for the photochromic lenses.
Okay.
As well.
That's interesting.
Yeah.
So I've come to understand, or I don't know, I guess with my little knowledge on the eye, I've always felt or thought that people who cannot see, at all, cannot see much without, their glasses, like from childhood all the way. And for them, it's everything. It's like whether they are looking into this room or they are trying to read, they can't, they can never see, right? I've always felt like they have like proper eye problems. And then there are the rest of us who, I don't know, age and all of these things. And all of these things will make it difficult to see on our phones, right? Because now when you want to look on your phone, you have to take it all the way back and all of that. So these are two categories of people. I mean, that's how I have rated them.
Okay.
I'm not an eye expert.
You're not entirely wrong.
I'm not entirely,
yes.
okay. But that's how I've rated them.
Yeah.
They're the people who just generally cannot see anything until they have their glasses on. And then there are the other people who, when they have to read, then it's a problem.
Yes.
So these both two types of people can use contact lenses.
It depends.
Okay.
It depends. So I'll take the issue about reading, having to push the item far back before you can see. That's what we call presbyopia.
Right.
So if you're a Presbyterian, the word originates from there.
Okay.
Presbyopia. That's purely age-related.
Right.
So typically, anybody who is 40 and above, in some instances, it could delay, but once you hit 40, you know that very soon you'll be needing reading glasses.
But is that accurate, though? Because mine started when I was nowhere close. And I'm like, what's going on? Why is this happening to me?
I mean,
why, though?
It could be anything.
It could be anything.
Yes, it could
because
be
I feel
anything.
like, but why am I facing this situation?
So if you're somebody who also has high levels of astigmatism,
okay.
you can develop.
What is that?
So with astigmatism,
Right.
what it simply means is that your eye is not focusing a single clear image.
Right.
So the eye is focusing the images at different points at the back of the eye. So
Right.
the image looks very blurry.
Right.
So you could be looking at a house and you're probably seeing multiples of that house, even though you're supposed to see it as one, because
Right.
your eye is not focusing a single clear image.
Okay, so we're going to wrap this up, but let me ask, is there any particular thing that brings this on? Because again, let me use my own experience. When I had my last daughter, I needed to have a CS. It wasn't planned. It was just, I was going to eat my salad, having a normal Saturday, and then I just felt uncomfortable, went to the hospital. Doctor said, okay, baby needs to come out now. I wasn't due, nothing was ready, but I had to do it. And before I went to the theater, my eyes were fine, right? And I always say that anytime I say this, I'm looking for a response that will resonate with this experience because I don't understand.
Right.
Before I went to the theater, I could see everything on my phone just fine. In fact, I made a few phone calls because I was still working at the time, so I had to send a few emails. Everything was fine. And my phone, I would hold it this close to my face doing whatever I needed to do. After the baby was taken out of me and I came back to the ward,
You couldn't see.
everything was blurry. And I thought, so at the time, I thought, maybe it's the injection that they gave me. Maybe it needs time to wear off. First day, second day, 1 week, 3 months. I'm like, what is going on? And I felt like there has to, like somebody has to link me to the before and after because it just wasn't working.
Okay. So it could be that the problem was there.
Right.
But you probably hadn't taken very good notice of it. So it's just coincidence that after the surgery, you're now noticing it. And so you're thinking it's happening after the surgery.
Right.
The other thing could also be, pregnancy and its issues. If you probably may have developed gestational diabetes, gestational hypertension, all of that. Even medications could alter your vision. So it could be anything.
It could be anything.
It could be anything.
Because I have struggled to find the link. It was just.
It could.
It was
anything.
less than 30 minutes.
It's also probably your eye just, your mind playing on you.
Oh no, but that's what has been since. So when I made the decision to go and see an optometrist, and they said, "Oh, this is presbyopia." I said, "But how old am I?" I'm sorry.
There's early presbyopia. People can develop it, 35, 36, up to 40.
Really?
So there's early, and then there's the normal presbyopia,
Right.
which starts after 40. So
I said, no. I'm sorry. I can't relate to the age you are mentioning right now.
yeah, so it could be anything. Yeah.
All right, Dr. Sylvia, thank you. Thank you so much for the education. We really love being, and I have said that this is, okay, I have said that this is one of my favorite segments on the show because we learn every day. And we have the different doctors coming to tell us about different things, which really enhance our knowledge so we know, what's going on with our bodies at all times. We really appreciate this education.
Thank you for having me.
So MJ wants to play you your favorite song. But before that, tell us where we can find you.
You can find Dr. Boamah at Lotus Opticals.
Okay.
That's my baby.
Yeah. Yes.
We're either in Sakumono or at East Legon on the Nisai Road. You
Right.
can reach us on 053-173-6933. Come in for your contact lens. Natalie, I think I want to give a gift. No, 2 gifts.
Yes, please.
To your listeners.
Yes, please.
So,
yes, please.
Yeah.
Okay. So, how do we gift them? Patrick usually decides these things.
Okay. So
if he doesn't end up giving it to his girlfriends, but
yeah. So I think I want to give a 500 Ghana, 2 500 Ghana cedis gift vouchers to your listeners.
To the listeners.
And
Patrick,
then they can visit.
They can visit Lotus.
Any of the Lotus Optical
in Sakumono
or East Legon. Yes.
To get.
You can redeem it from any of the 2 branches.
To get something.
Yes.
To get a frame.
Get
to
your
get
eyes checked. Get a frame. Get contact lenses, sunglasses, anything.
Anything. All right. So I have the vouchers here.
Right.
Patrick, how do we give them out? Are you going to decide? Do we do it now? Do we do it tomorrow? I should wrap up. Okay. All right. So MJ, please, the favorite song, Dr. Boamah. What is it? What is it? What is your favorite song?
Maybe King Paluta.
King Paluta. The new one. Hey! Patrick, we have a favorite song. Thank you so much, Dr. Boamah. Thank you so much. All right, so that's it for Doctors.